To be clear, we're ready for the warm-up that's coming. Boy, are we. But we still have a few more hours of brutal cold to get through first.
Yeah, this morning our 9 News medical expert Dr. Pyle Coley joins us to talk about the dangers that this cold poses on all of us. Dr. Coley, good morning to you.
Good morning.
Talk to us a little bit more about frostbite and hypothermia, because those are cases we're seeing pop up with this cold.
Yeah, these are two big ones, and they can both be life-threatening. And in weather like the type we've had this weekend, frostbite can set in about 30 minutes or so. And that's basically the tips of our nose, the tops of our ears, our fingers, and our toes. And that's because the blood vessels that supply these parts of our skin are very tiny. So when you spend time outside, especially if there's a wind chill, even if they're covered, they can constrict those blood vessels, cause them to choke off the blood supply, and those parts can actually die off in about 30 minutes. Now, hypothermia can happen in 15 to 20 minutes in the types of temperatures that we've seen. And again, that depends a little bit on how much we're covered up. But if our body temperature drops below 95 degrees, we start sort of shivering, try to make heat. When that fails, you can actually have problems with heart function and cardiac arrest.
What about the cold and what it does to our heart and our lungs?
Yeah, so just being in the cold is a stress on our heart, right? Because our heart is pumping harder and faster to try to keep us warmer. And so people who have pre-existing heart problems have to be really careful going out in the cold, doing anything strenuous. And with all that snow that we've got now sitting on our front door, we have to think really hard about whether it makes sense for us to shovel or we should get somebody else to do it. So if you have high blood pressure, heart disease, you've had stents, you want to make sure you talk to your doctor before you start to get out there and start shoveling. Even if you don't, you want to warm up inside before you go outside and do that. And then with our lungs, you know, our airways can go into spasm, even if we don't have asthma or heart disease, because that cold really causes those airways to constrict as well, so we can start wheezing or feeling short of breath.
I want to go back to the hypothermia and the frostbite for just a little bit, because how do I know the difference between I'm just really cold and I'm shivering to the point that it's time to get my butt back inside?
Yeah, so shivering is the earliest sign that your body's starting to compensate and you need to get inside. So if you start shivering, that's already a sign that you need to. But if you start having any confusion, any increased urination, and the problem is when we're out in the cold, we sometimes, our cold sensors also get impaired. So we also don't feel cold as much when the skin stops getting the circulation. So if you start tingling, or if the color of your toes or your nose or your fingers or your ears changes, it becomes pale or purplish, you're getting yourself in trouble.
Okay.
Beyond all that, I just feel like the cold changes our behavior so much, right? Like you don't want to do anything. You don't want to work out. You don't want to move the body. And that's not, I know, right? That's not good either.
It's not good. And we stay inside and we drink a little alcohol to warm up, which is the opposite. Alcohol makes our body lose heat. So we're more sedentary. We can have seasonal affective disorders. We can also just feel depressed from the cold. We don't want to exercise nearly as much. We're running more things that can generate carbon monoxide. So we're also at risk for carbon monoxide poisoning as well when we spend a lot of times indoors. And the cold impairs our sensation of thirst, and it dehydrates us. So we get this double whammy where we're not drinking enough water, we don't even feel like drinking, and we can get dehydrated very quickly.
And then you eat all the comfort foods on top.
I know, we were saying, we got the cheeseburgers, the fried chicken, which is funny because we normally eat pretty well, I feel like, but not when it's cold outside.
So you really do have to watch what you eat and stay away from that caffeine. As much as it feels good to drink a hot cup of coffee, I'm going to tell you to drink broth instead or drink warm water, but not caffeine, because that can also do that.
Between Dr. Coley telling us not to do that and Steve Steger telling us to ditch the McDonald's this morning.
What is happening?
What is happening? Dr. Coley, thank you very much. We appreciate the information. By the way, you can find all of Dr. Coley's appearances on 9news.com/Dr. Coley. There's a lot of good stuff there, so check it out.